I welcome everyone personally for this webinar. It's a very interesting topic also for me. I've been in this kind of practice of longevity medicine. In Asia, it's called anti-aging medicine, or even in the US, and which has gotten more on the aesthetic side, more than the science of how to help people age gracefully or be at the prime of their life, even if they're after 60 years old. So there has been a lot of proposal on the biology of aging, and just to name some of them, one of which is describing the cellular level of aging that happens when stressors, it could be extrinsic or intrinsic in nature, meaning inside the organism, or it could be outside the organism, that could promote random molecular damage. So they could happen almost on a daily basis in a human organism. And this accumulation of unrepaired damages that happens randomly could actually cause certain form of communication intracellularly that could lead to inflammation and eventually leading to cellular defects. And as you know, when cellular defects are promoted inside the body, it goes to the next level, which is a tissue dysfunction, and that promotes the aging process. But at the cellular level, this aging process could actually be mitigated by the use of antioxidants or something that could repair these damaged areas of the genetic code, or even in the cellular level, certain organelles that have been damaged because of stressors. And so the use of antioxidants have been popularized when it comes to its capacity to remove certain substances that could promote aging process, or could somehow remove the stress response that could promote more aging in certain tissues. And of course, part of the strategy that they have proposed to be able to reverse the aging or to improve the status of the cell is the capacity for tissue regeneration, wherein it addresses inflammation or any methylation changes, as well as repopulation or reactivation of the long dormant stem cell population inside the body. Very recently, in a book published by Dr. Dave Sinclair called Lifespan, he was able to summarize a few key processes that can promote aging on the cellular level. And he mentioned something about the DNA damage and repair, as well as the shortening or attrition of telomere length, as well as the loss of protein balance that is actually susceptible to oxidative changes, the mitochondrial health and the accumulation of reactive oxygen species, and lastly, the dysregulation of cellular signaling, which are very interesting factors and well established in the laboratory and even in some animal studies. Next slide, please. But aging, as we know today, is not due to just one factor. It is still multifactorial. It could be because of increase in the damage of the DNA, or it could be because of the loss of some salvaging mechanisms in the body to promote health more than the aging or the damage of certain cells or tissues in the body. And so mechanisms for aging are not isolated. It is always an interaction within, intracellularly, and also externally or outside the human body. So when we look at the biology of aging in the systematic level, these are the symptoms, or these are the signs that patients would normally notice. So it's either you see it in front of the mirror, or it's something that you could actually make as a complaint to your practitioner, to your doctor, or something that you would actually talk to your relatives or to your set of friends. So they talk about from the cellular damage or the promoting age promoting changes in the cellular level. When it goes into the tissue or organ level, you see some loss of collagen, and so the tissue plasticity becomes diminished, the skin becomes wrinkled, or the muscle becomes atrophied. So we see this a lot in people who are exhibiting frailty, the muscle mass is actually decreasing, and their length and their strength is actually being compromised. Also, their loss of hearing or the loss of good eyesight. These are also like some of the senses that are compromised when it comes to the aging process. And a big part of what we know today that could herald aging in the systematic level is the aging of the immune system. People get more sick, or they easily don't recover from a simple infection, or they can even be more at risk for sepsis, even for just a simple infection that has been not diagnosed early. Then the wear and tear of certain organs in the body, such as the liver and the kidneys, are also part of the systematic level of aging process. Also, the cognitive function is very important. We know that when someone is aging, it might be expected that their cognition is also compromised, or the loss of performance, not just when they retire from work, but also the performance in bed, the loss of libido, the inability to maintain erection, or even for most organisms, when we're aging, the loss of procreation, the capacity to create offspring, is also part and parcel of aging process. Next slide. So in the past, what has been proposed is the free radical basis for aging, where people were saying that because our body creates a lot of deleterious effects because of the processes that we need to maintain to create energy and to do metabolic processes, we could either be creating the reactive oxygen species, or this could be promoted because of external factors, and that's the use of antioxidant will mitigate these damages in the molecular and macromolecular level, and it's like has been dispelled in 2017, because they say that antioxidant is not the key to lifespan or to longevity. And now they're really considering what Sinclair has been proposing, that it's a multifactorial event where different aspects of the aging process could be changed, both epigenetically and also from nutrition standpoint, and even through lifestyle modification. So now on the right side of this diagram, you see that it's not just about antioxidants that there's a major player in aging process, although this is part of the mitochondrial dysfunction aspect of the aging, but also telomere attrition, protein balance, the immune system signaling responses, and the so-called inflammaging. So when we talk about inflammaging, it's a term that's been coined to combine inflammation and aging process. As you know, inflammation is an internal regulator. It's a signal response that tells our system that something needs to be fixed or something is wrong. Now, inflammation does not only occupy the pathway to aging process, but it also occupies a certain role in promoting anti-aging responses. So in the absence of inflammation, the body won't be able to know what to fix or where to fix it. But chronic inflammation, meaning it may not trigger a big alarm in our system to control or to mitigate any damage, but the low-grade inflammation with age and chronic presence will actually promote deterioration of the organ system, such as in cardiovascular diseases, in metabolic syndrome, in the form of bone health, and even in certain form of cancer, where the loss of function of certain organs are actually overpowered by a new formation of tumors or set or ball of diseases. And so even degenerative diseases of the brain could also be due to a chronic low-grade inflammation. And so there has been a lot of studies involved in finding out what really triggers inflammaging in human condition. And it's also multifactorial in nature. They found out that there should be a genetic susceptibility, the creation of fat, like bad fats or even the end glycating agents because of circulating amount of sugar and the sticky part of this inflammatory reaction can also trigger aging in that sense. Also, the changing in the gut biology. We have always been treated with antibiotics, or even sometimes we have changed the way we eat. We are creatures of habit, or also we have solved our food problem by taking something that's not real food anymore, and so it changes the gut biology, and that causes small degree of inflammation that long term could affect inflammation of and also the immune system response. Also, the process of cellular aging and oxidative stress and chronic infection also, they hold integral part in promoting inflammation that's beyond what the body could actually fix later on. This is a graph that shows how aging and age-related chronic diseases are affected by inflammation and how it could actually create a strong effect on the adult immune system. And the key here is that the threshold for our body's inflammation is determined by the predisposing factors prior to a human reaching its adulthood. So there's a lot about intrauterine factors while the baby's under the mother's womb, and a lot about the introduction of healthy substances from breast milk, as well as the intervention done during childhood for immunization or the use of antibiotics that could actually affect one's response for inflammation. I'd like to also remind again that inflammation is not at all bad. We need inflammation to be able to direct certain processes, but sometimes this firing of information could be too much, and it could be coming from different parts of the body that can make our internal system not as efficient or not as robust as we want it to be. And the presence of inflammation would accelerate the process of aging because of the effect, on oxidative stress and the other aspects of the aging process, leading to brain diseases, cardiovascular demise, also the wear and tear of our joints and our organs, such as in the form of pancreas when it comes to diabetes, or also the formation of cells that are foreign to our body in the form of cancers, or even the defects that's happening in the DNA level. So these are all part of what we call cellular senescence, or the aging process, where there's reduced cleanup system in the body, or autophagy, and also it promotes like a challenge to the immune system being able to identify between what needs to be allowed and what needs to be mitigated in certain form of or condition. Next slide, please. So with all these bases for aging, whether it's cellular, systemic, whether it's because of inflammation, same question arises, from each one of us. The question of like, how do we really slow down aging? And we know that in the next couple of years, reaching 100 years old will be the next 80. It's the new 80 to be 100. But what comes with the aging process, we know, is the deterioration of function, or the incapacity to perform similar function as like a 60-year-old. And so would you really want to reach 100 when your performance is actually compromised? Would you really want to be in the late 80s if you're bedridden? So there's a lot of question about slowing down of not just the aging process, but also slowing down the accumulation of diseases or those substances that could promote degeneration of certain organs and tissues in the body. So if you look at the centenarians, there was a study done in 2020 about the number of centenarians, and there's still a lot of them coming from Japan. And also a big part of them still comes from France. and also in South American countries. And they were able to map out that the shared characteristic of centenarians wherever they are in the world is that they always belong to a higher socioeconomic background and education. It may not be based on family statistics, but it could also be that they come from first world countries. Like there was even a time in 2017 that there's a lot of centenarians coming from the US. And it's because of the capacity of these people to have the resource to invest in better health or diagnosis of disease or even treatment of certain beginning diseases. Also, shared characteristic would be delayed disability. They're more physically active. They tend to walk more, travel more, use the train more, and they move from one part of the country to another without the use of automobile, and they always like see to themselves that they're productive, whether it's gardening or doing something that would actually promote benefit for the community. Aside from that, it has also been documented that these people have longevity genes. They have inherited characteristics coming from their ancestors that, when coupled with healthy lifestyle and also diet and exercise, it promotes longevity because they are carriers of what we call longevity genes, and we will tackle some of them later on. Aside from that, there's a delayed development of chronic diseases, which is important because the less diseases you develop in the first 60 years of age, the less also would be the risk for other diseases that would come as a secondary effect of those primary health challenges. Also, they have less percentage of life spent sick. This is what we called as health span. You know, you could improve your age span reaching up to 80 or 100, but if majority of that lifespan is spent in bed, being sick or hospitalization, then you wouldn't really expect a health span that is actually congruent with the lifespan that one is living. And so the preventive aspect of you not being sick is very important to dictate whether you're going to be sick later on in your advanced age. And also there's independence for longer age, meaning they value healthy independence. They're able to become self-agent, like they're able to be on top of their nutrition, on top of their physical activity, and they have a better disposition when it comes to their outlook when it comes to life. And also they have less psychological disorders, which allows them to become less depressed. And as you know, when a person is demented and they start to feel depressed, then comes Alzheimer's disease. That's one of the best predictor why a person would develop from a demented state to Alzheimer's is when they feel low or depressed. So what are these genes that we know, according to study, that are exceptionally associated with longevity? I have listed a few here for you to look into, and some of them are very important because, for example, the ACE or ACE angiotensin renin-angiotensin system, which is important for regulation of blood pressure, and also it's very important for tissue repair. You know that a repair mechanism is controlled by blood circulation. If blood flow is not reaching a certain organ, it won't really be expected to regenerate because it's not being addressed by the immune system properly. And also it prevents, it also promotes the nutrition to certain organs of the body. ApoE is another good marker for longevity because it talks about lipid and cholesterol homeostasis or balance. And this is the same gene implicated in the formation of amyloid or beta amyloid in blood-brain barrier that is actually implicated in Alzheimer's disease. And carriers of ApoE4 would be more likely to develop Alzheimer's disease in the presence of sugar problem. So we know in studies that if someone is a carrier of ApoE4, and as long as you prevent them from having a sugar imbalance or a sugar problem or diabetes, you're also protecting them from their cognitive decline. But once a patient with ApoE4 gene starts to develop diabetes, it goes downhill from there. The FOXO3A is another important longevity gene because it helps with metabolic processes and also with apoptosis and oxidative stress. And G alleles are always linked to longevity because it has a protection for the heart muscles, which we know would be very difficult to regenerate in cases of damage or in cases of lack of function. The KLOTHO gene, on the other hand, is very important for calcium and phosphorus homeostasis, and it balances inflammation, and it's very key regulation for the preservation of stem cells. And we will talk about stem cells in one part of this lecture to be able to show you the part where regenerative medicine is important to mitigate the effects of aging. And of course, interleukin IL-6 is involved in maintenance of healthy inflammation in the body and also for B-cell maturation. So longevity genes play a bigger role in the later stages of life because not because you have longevity genes that it will dictate a healthy lifespan, and it would only be beneficial if these longevity genes are known in the first place and the patient has gotten to do everything in their power to help improve their expression towards the end of their life. Next slide, please. So the former saying that your genes are cast on stone is no longer applicable because we know that today epigenetics or the epigenome has a lot to do with the switching on and off of those genes that may be disease promoting or could be improving lifespan. So the role of the environment, most especially the role of the factors happening during the conception is very, very important to actually mitigate certain methylation processes in the genes and also in terms of propensity for disease. So for example, for the ApoE4 gene linked to increased risk of Alzheimer's disease and shorter lifespan, and at the same time, the FOXO3A that's linked to increased longevity are both influenced highly by epigenetic regulation. And as I mentioned, a lot of these influences happen even before the baby has been born because 75% of the mother's capacity to take care of the baby in the womb has a lot to do with the epigenetic benefits or epigenetic influences on only the 25% of the genes that are present for the organism. So such as smoking, or if the mother has been depressed or having some mental issues, or they develop diabetes during pregnancy, or they're malnourished, like the lack of folic acid, or the lack of proper nutrition, can all impact the expression of longevity genes. There was even a study before that even the level of vitamin D among pregnant women will dictate the development of whether or not the baby in its adulthood will develop diabetes. So the level of vitamin D during conception is a predictor for whether or not the baby in the womb will develop diabetes later on. So that's how strong and important epigenetics is, as they're influenced by nutrition, by certain substances, and also by mental and emotional function surrounding the pregnancy. And a big part, of course, of this characteristic benefit for the aging process during pregnancy and even after pregnancy is the microbiome health. You know, because a lot of the beneficial immune system components that are present in the baby would normally come from the mother's vaginal tract, and also would come from the mother's own microbiome. You know, we have several microbiomes in the body. It could be skin microbiome, gut microbiome, vaginal microbiome, and the best way to transfer those healthy organisms are through the vaginal tract or through ingestion of the microbiome from the mother. And these are very important because once these microbiome are are well established in the gut of a baby, and they eventually get compromised because of the use of antibiotics or the lack of sufficient amount of breastfeeding, or maybe the lack of exposure to the environment. Maybe they're so sheltered, they're not able to play on the ground or touch soil or dirt. These are triggers for maturity of the microbiome. That's very important also in the aging process. And so the first 1,000 days of life, of the the unborn fetus and also the infant are very, very important in the development of a healthy epigenomic responses to longevity genes. Now, the diet has also a big part in promoting longevity, as what Professor Lungo has actually published in his book, The Longevity Diet, and what the Prolon product is actually based on is on the basis of autophagy, or the capacity of like creating a stressor in the body that's not going to kill the system. So whatever what doesn't kill you makes you stronger. So the restriction of certain food or food elements and putting a patient on a fasting mimicking diet will trigger certain behavior in the body to remove anything that's actually disease promoting or cancer producing. So it's a very good revamp, or like an overhaul for the system, to be on a fasting for a couple of days in a year, or even to espouse a fasting mimicking diet that allows you to eat little bit but also triggers a fasting effect to your system. So some people, they swear by fasting, and they use Prolon to schedule certain time of the year where they could actually trigger autophagy. And the benefits that they get from it, aside from autophagy, is because it also facilitates body depuration. It activates the use of energy reserves, and therefore it promotes weight loss in certain events. And it also brings down the inflammation threshold in the body. It also improves the sugar response, and it resets the body's glucagon and insulin responses long term. And it even improves the cholesterol buildup in the body, and it protects cognition, because, as you know, as I mentioned earlier, the more sugar is the problem in the body, the more it becomes a problem for the brain also. Now, this part of the lecture, we wanted to introduce some of the longevity supplements, and the choice of supplements would be always directed towards whether these substances could reduce epigenetic noise and has the capacity to rejuvenate cellular tissues. And I have grouped them to a few categories based on their capacity to mitigate aging responses. So one group of supplements, they're called AMPK activator. They serve as the gatekeeper of energy homeostasis, that when AMPK is not activated, they inhibit energy consumption pathways. And also, they can affect the energy generating pathways such as glycolysis and glycogenolysis. And once you activate AMPK pathway, you will benefit from this counteracting the ill effects of metabolic syndrome, meaning the increase in abdominal girth, the propensity to develop diabetes. It also prevents the base excision repair system that can promote genetic alteration. And it can even reduce the risk for tumor development or cancer. So there are several AMPK activators. They could be indirect, which are very popularly used these days, such as in the form of metformin, polyphenols such as resveratrol, quercetin, berberine, and curcumin, or a direct activator of which, like salicylate, which is a precursor of aspirin. Another group of longevity supplement are the mTOR inhibitor. It used to be called the mammalian target of rapamycin. Rapamycin is an antibiotic that was discovered in Rapa Nui, which was very initially used for treatment of athlete's foot, but later on has been found to be effective for controlling the host versus graft reaction for organ transplantation patients. Eventually, the M in the mTOR has been changed to mechanistic rather than mammalian target of rapamycin. And if it's not inhibited, the effect of mTOR is on the regulation of cell proliferation. They promote inflammation in the body and they inhibit autophagy. But when you have mTOR inhibition, the benefit you see from here is improved lifespan, anti-cancer activity, and it prevents neurodegenerative diseases as a specific target for these longevity supplements. So some people, they use low doses of rapamycin to help inhibit the mTOR. But if you're not really keen on using pharmaceutical products, there are natural substances that can be derived from green tea, for example, in the epigalactocatechin gallate, certain form of organic coffee from the caffeine that's actually integrated in there, or the use of curcuminoids and the use of berberine supplements, quercetin, and again, resveratrol, and also pterostilbene, which are very powerful mTOR inhibitors. Aside from this supplement, you need to also understand that caloric restriction and removal of methionine or restricting methionine in the diet could also decrease mTOR activity as well. Another supplement that we have in our Nordic supplement lineup is what we call NAD booster. So NAD is very important because it is a coenzyme for mitochondrial energy metabolism. So there's a lot of discussion. Is it going to be NADP, NAD plus, what form of supplements? Because NAD will prevent genomic stability, and it drives epigenetic regulation. And it's a very important a driver for post-translational protein modification. So the benefit that we get from NAD boosters, it doesn't have to be just the NAD supplement alone, but even the boosters are known to become geroprotectors. They prevent or delay frailty in the elderly. And of course, they prevent the formation of tumor or tumorigenic tissues. And similar to AMPK, they also can prevent neurodegenerative diseases. So supplements such as nicotinamide and NMN supplements are very important to be included in your daily regimen. Aside from that, if you're not keen on taking supplements, by just caloric restriction, exercise, and adequate circadian rhythm can also help. Another group of longevity supplements are called senolytics. These are a class of pharmacological agents that eliminate senescent cells by inducing apoptosis. So a big part of the problem in the aging milieu is that the inability of certain cells in the body to die. They're called zombie cells or zombie tissues. They're already non-functional. They're already like dead in terms of their physiologic mechanism, but they remain in the system and they can cause or trigger a lot of inflammatory reactions in the body. And so therefore, the big function of senolytic supplements is their ability to clear the old cells. So their ability to remove those zombie cells that we call in the body. And so by doing so, they can delay, prevent, and alleviate frailty, cancer, and certain systemic diseases. There has been a few senolytic pharmacologic agents that have been recorded in studies such as dasatinib, which is a biological, but also natural supplements such as quercetin, fisetin, and navitolax can also be used. Now, this is where intermittent fasting come in as a strategy for improving age span. And because intermittent fasting can help promote the removal or clearance of senescent or old cells. Same goes with caloric restriction, and most especially exercising during fasting can also help. So the topic on the supplements could be, we could add more to that every so often because there are new studies and new supporting journals that could actually promote or even include different substances that could promote longevity. But one of my favorite topic when it comes to what really promotes a healthy lifespan is the reinoculation or refurbishment of healthy cells into the body. As we know, stem cells are very important in organogenesis, most especially during the time when we're still fetuses in our mother's womb. And there are several types of stem cells based on their function. We have the embryonic stem cells, which are very, very important in formation of organs, and they're very aggressive and they're very efficient. And there's the so-called adult stem cells. So adult stem cells are harvested from a full-blown organism, such as even an infant can be called a source of an adult stem cells, because they could probably getting the stem cells from the umbilical cord or the amniotic tissue. So even if they're babies, they were still considered as adult stem cells because they didn't come from embryos or they didn't come from an unborn child. So they're really term at birth. And the so-called induced pluripotency, which has been exhibited in the Yamanaka factors in the recently published and also awarded studies by Professor Yamanaka from Japan, where a stem cell from any source could be manipulated and could be induced pluripotency. Pluripotency is a term they use in stem cell biology, that's the capacity of the cells to become any tissues in the body. Next slide. Because one of the most ethical and the mostly used source of stem cells are the so-called mesenchymal stem cells. These are called mesenchymal stem cells because they come from certain part of the body called the mesenchyme, or those that are actually sourced from the bone marrow, from the fat tissues and umbilical cord tissue, not the blood. They used to be a former notion before that you need to bank umbilical cord blood, but they found out later on it's the umbilical cord that really has all the stem cells. And so therefore now they're even like considering amniotic sac, which are good sources of tissues also for stem cell harvesting. Now, one thing that I want to discuss about mesenchymal stem cells is that they have a very unique positioning when it comes to therapeutic effect. The goal of using mesenchymal stem cells, number one, is for regeneration. Regeneration because once we are a full-blown organism, like a baby after term, we don't develop another organ in our body, but we're capable of repairing problems or diseases or injury because our body sets in motion certain triggering devices that will allow certain stem cells to migrate and to repair that system. So we have a capacity of regeneration. In fact, it takes 7 years for an organism to fully regenerate, given that we don't have a concomitant deterioration of function. So the more we age, the faster or the less efficient would be our repair system, because before the 7 years mark, we are already like deteriorating some other aspects of our organs. And so the use of mesenchymal stem cells to be brought into treatment in the clinic is very important because they could affect the organism in two ways, either by direct effect or by indirect effect. By direct effect, I mean that when they home in to certain organs or tissues, they have the ability to copy or to regenerate or to repair any damaged tissues right then and there. But sometimes these stem cells, they don't really find areas where there needs to be repaired, but they home into around the surrounding tissues that are also healthy. But they also excrete paracrine effects or endocrine effects, where they release into the circulation certain soluble substances that could promote immunomodulation. And so therefore, the reason why mesenchymal stem cells are also used to calm down the immune system in cases of autoimmune diseases, or those diseases that are triggered by environmental factors, such as, let's say, pollution, or let's say toxic exposure, and even sometimes infection. So the reason why we ought to use mesenchymal stem cells is because the source comes from a full-blown human organism already, and we don't need to sacrifice the use of embryos just because they're more aggressive. Well, it's also a setback to be using embryonic stem cells because their aggressiveness may also create or may form teratoma or tumors in the body. And for mesenchymal stem cells, the treatment criteria for you to know, let's say you're trying to figure out, okay, is this company good for me to employ when it comes to stem cell treatment or regeneration, is they need to satisfy 3 criteria. Number 1, they must be plastic adherent. So the laboratory should be able to demonstrate that these cells, they're spindle shaped by virtue of how they appear under the microscope, but they adhere to the plastic, let's say in the tube or in the culture media where they're actually being propagated. Number 2, they must express certain CD markers, 105, 73, CD90, to separate them from hematopoietic form of stem cells, because these are characteristic markers for mesenchymal stem cells, because hematopoietic stem cells usually just divide or give rise to hematopoietic blood products. Unlike mesenchymal stem cells, they could produce chondrocytes, they could produce neurons, they could produce even fat cells in the body that could be beneficial for certain diseases. And lastly, mesenchymal stem cells must be able to differentiate in the laboratory to osteoblasts, meaning bones, adipocytes, meaning fats, and chondroblasts, meaning cartilages in the lab. So when I use stem cells for my patients, these are the criteria I look for the lab. I ask them, how sure are you that we're dealing with mesenchymal stem cells? What if your source is amniotic sac or fat tissues? What if you're only giving another fat tissue? Because a stem cell would exhibit these criteria when they are actually studied in the laboratory. Now, just a few tips. As a biohacker, I know that you have probably researched a lot about stem cell regeneration and the use of stem cells in a lot of anti-aging or longevity practices. But I always want to give a tip when it comes to how do you know that you're dealing with the right product. So first is you have to know the source of the stem cells. Is it coming from humans, first and foremost? You don't use something that comes from animals, or there were a lot of companies before saying that you can take stem cells in a capsule because they come from apple seeds or from certain plants. Stem cells need to come from human tissues because they need to behave for greater repair of the tissues of a human body. But whether they come from embryos or unborn fetuses, or they come from adults, as I mentioned, infants, umbilical cord is considered to be an adult stem cell because they're more ethical and they're also safe. Like if you use embryonic stem cells, yes, they could be good for regeneration, but sometimes you cannot stop them from growing or from regenerating or from building cells that are not needed in your body. So the risk of getting tumors or cancer is likely for those using embryonic stem cells. Second, how are the stem cells extracted? What sort of technology they use for sorting and for finding out the quality control? So whenever a patient needs a stem cell infusion and they found a company, I always tell them, can you provide me a paper that shows your release criteria for me to know that nothing in the process of propagation or purification of the cells, that there are no chemicals, there are no beads, there are no culture media that's actually infiltrated or impurifies the sample, because you only want to receive cells and not the very compounds that were used to propagate them. So there needs to be a quality control criteria, set of criteria that you need to check, and it's by batch. It's not because they've proven it before. So every cells that have been released from the laboratory needs to have a quality control certificate. Number three, you also need to know the number of cells. There are stem cell company that would only promise you 10 million cells, and they would charge you an arm and a leg. Well, in fact, recent studies show that the most effective dose of stem cells should be given at 1 million per kilogram body weight. So if you're a 60-kilogram male, you need at least 60 million cells, and it doesn't have to be infused in one go. It can be infused in a, like maybe 20 million cells every 3 months, so that in a year's time, you're able to really put back into your body more regenerative function rather than deterioration that happens every so often, most especially if you're exposed to a lot of stressors in the environment. And then also, number four, what are the clinical aspects of the treatment? Are you given a pre and post tests to show that you have really improved? Is there any specialist involved? Let's say you want to improve your cognition. Is there a neurologist on board? Or you want to probably improve your blinding disease? Is there an ophthalmologist involved in the team? And also, very importantly, stem cells should always be combined with vitamin supplementation or infusion before after the treatment, because these cells need support. And also, like in one of my studies in my undergraduate thesis, vitamin A, for example, can promote stem cells to become neurons in the body. So you don't need to manipulate them in the lab, even if they're as primitive as they are. In the environment of good vitamin supplementation and specific vitamins, they can become what they want or what you want to be in the body. And lastly, what are the various quality control release criteria for the cells and their cutoff values? The cutoff value is very important. They may be able to exhibit quality release criteria, but if the cutoff value is kind of lax or lenient, then the chances of it not being pure and causing or trigger some side effect may be high. You know, this is what you need to remember about stem cells. Stem cells have been proven, if they come, let's say, from umbilical cord or from mesenchymal tissues, they're proven not to elicit any immune responses from the recipient, meaning it doesn't have to be from your own body. You can have a donor of stem cells, another human, as long as they're really mesenchymal and primitive cells, they won't trigger any immune or allergic response. But what could trigger an allergic response are sometimes the media, the culture media, or the propagating substance they use for the isolation of stem cells. And so therefore, release criteria and the cutoff value is very, very important. So we've discussed about supplements. We have tackled a little bit about stem cell treatment. Now I'd like to also give a little focus on the value of meditation and mindfulness. You know, the Buddha in one of his teachings said that there is no aging in the present moment. And from that text, from handed on from one generation to another, now it's kind of showing its effect on the value of meditation and mindfulness. And there's a lot of important studies that could really prove. Way back before, the only study they have among Olympic meditators, they call this the monks, was the MRI pictures of how the amygdala or certain parts of the brain are changing when monks are meditating. But now we could also measure the amount of DNA methylation. We could measure telomere length, and they have been all proven to improve longevity by just the power of mindfulness and meditation. So as the last slide for this webinar, my recommendation for all of you, for all of us who's actually keen on improving not just age span, but also health span, the number of years that we are productive, that we're not sick, and we're able to do more contribution to this world, is to understand the mechanism and overview of how we age. Each person is different. You know, as I mentioned, even if you have longevity genes, the terrain the playground could be different depending on epigenetics. You have to know your own unique DNA, because knowing your profile will be able to give you more understanding of how pharmacogenomics, pharmacogenetics, and also other epigenomic factors could actually be interplay in your aging process. And also to adapt to a longevity diet, no matter what kind of diet, whether it's veganism or anti-inflammatory diet or elimination diet or diet made from uncooked substances or food or ingredients, it's always good to mimic fasting around 1 to 2 times a year, because it's healthy for body's regenerative purposes. Appropriate supplement is very important. As I mentioned again, the supplement should be directed not just for antioxidant effect, but also to remove senescent cells in the body, and also to promote the growth of stem cells that are actually dormant for years. And very important also is movement, to be able to move around using physical activity and improving circadian rhythm, because it is only when you're asleep and in your deep sleep cycle that your body can fully regenerate and could also fully improve its function and capacity. And also, I would encourage you to start a meditative practice. It doesn't have to be just a sitting meditation. Any contemplative practice, for that matter, is very important, because some people, cooking for them is meditative. And some people, just turning off the mobile phone during the evening, during their sleep, is already a part of engaging into mindfulness. So these are all very important and unique strategies that you could actually discover yourself. And lastly, to value and consider cellular regeneration therapy if needed. And if you have any question, if you have any, let's say, stem cell products in mind, I'm always at your disposal to help you decide and to find which ones will be appropriate for your needs. So again, I would like to reiterate what the Buddha said: for in awareness of the present moment, there is no aging, which is important because you can only do so much for today, and that's important for us to seize the day all the time. Thank you for your attention.
Thank you, Dr. Rex, for such a really insightful presentation. I found it particularly interesting how in a lot of recent studies, they've been able to demonstrate at a physiological level all the benefits of mindfulness and meditation. Because I mean, it's very well known how, it can promote the self-perception of well-being and mental calmness, especially in such a world of stresses. But I find it just very interesting how we're able now to objectively, study the beneficial effects of all these practices. There was a couple of those, for example, that I jotted down. One that increased significantly the levels of glutathione, one a chemical that can really help our cells protect themselves from oxidative stress. Others, for example, that they increase the concentration of brain-derived neurotrophic factor, and how it can play a significant role in the prevention of some cognitive diseases like Alzheimer's, maybe even some Parkinson's. And some studies have even proven that these levels have tripled in some of their meditative patients. So I think it's quite shocking that we can have, of course, all these approaches to longevity, like nutrition, exercise, supplementation, all these therapies. But it's very easy to miss out a very key factor, which is, like we've discussed at other times. It's very important to, of course, truly believe in all the beneficial effects of all these approaches to longevity, and to overall have a very good, healthy mental approach towards all these practices. I think that's very key, because, of course, we all want to live long lives, but we want to live long, healthy lives, right? We don't want to be, sick in our early stages and and spend most of our time in bed when we are in between, say, 70 and 90, or over 100. But yes, I want to really thank you for such an insightful presentation. I think I want to apologize, of course, for a little bit of our technical issues, but I think we've managed very well with the slides in that sense. So Martin, if you have any questions, of course, now is your chance. And if not, then of course you can put them in our chat, in our group.
Yes, thank you. No, it was a very clear presentation. Yeah, very useful. Thanks.
Of course, thank you for being here. And yeah, so again, thank you, Rex, for the great presentation. And I look forward to keep researching on all these things, to keep working with you guys and move forward on this experiment.
Thank you, Andy.
Have a good one.
Bye.
Bye-bye.
Bye.